All right, we're doing some hand filler injection today. So we inject fillers into the hand to fill in these depressions and concavities in between the bones usually. So sometimes as we age, we lose some volume in our hands. The tendons become more obvious, the tendons in the veins, and we get some hollowing from the bulk of the muscle volumes decreasing and a little atrophy in the muscles. So that's what we try to do for rejuvenation of the hands with the fillers, is fill in these concavities. So this is a nice little procedure. There's actually a product that is FDA approved for this, is the Restylane Lift, and it really has, there's very little discomfort. What we do is we make 3 tiny little pilot holes with a needle. I've given her a little local anesthesia at these sites. We've treated this right hand already. We're going to treat the left hand now. But we make little holes in between the knuckles on each side, and then we use a blunt cannula to inject the product, so there's very little discomfort. So we've already given her local anesthesia in these little areas here. We just have to make a little site for the cannula in between each knuckle. And then we can do all the injections to those 3 little sites. We're going to prep with a little betadine because this is a long-lasting hyaluronic acid filler. We don't want to get any contamination or infection. And then we use this cannula, which you see does not have a sharp end, and it's got a little side port here, side hole, and that's where the product comes through. See a little bit of product. The primary thing we want to do is fill in these gaps between the tendons. And because this is not a sharp needle, there's very little bruising, very little discomfort. There's always a little bit of swelling, just like there is with any of these filler treatments. We have the patient's ice, and also we recommend using some tight gloves and wearing some tight gloves when you're home in the afternoons and evenings to try to manage the swelling. That's only necessary for a few days. Just like with most of these products, they draw in some water, so there will be a little swelling in the first 48 hours or so, and then it resolves in by the next 24, 48 hours.